Jonathan Howard. I'm a practicing chiropractor from England. I practice in Oxford. I'm a graduate from the Palmer College of Chiropractic, and I graduated in 1970. I'm on the board of members of SAWSI, and I'm a diplomat in craniopathy. Today what we're going to discuss is Category 1, and we're going to follow the PG guide as much as we can. You no doubt have already seen the anatomy and physiology, so we're going to briefly go over the anatomy and physiology once again, just to refresh your memory. But by and large, what we're going to do is to try and follow the PG and show you the technique as it is applied in our office on a day-to-day basis. If we look down at the chart here, we have a normal symmetric spine. And if we look at the lower picture, once we've removed the bones of the spine and the cranium, we have the dura, representing the dura, the meningeal dura, and the spinal dura, the cranial reciprocal tension membranes within the cranium, the spinal dura going down and enveloping the spinal nerve root at the dural sleeve and terminating in the dural port, and of course the anchor point of the dura at the second sacral tubercle. Category 1 is a bilateral sacroiliac fixation, where we get one innominate going anterior and the second going posterior, creating a rotational movement and causing compensation and adaptation at the pectoral and cranial areas. Once again, if we remove the bones, we see the cranial reciprocal tension membranes have now started to torque and twist. The spinal dura has torqued, and there is a torque mechanism around each of the spinal nerve roots at the dural ports, thus creating hydrostatic pressure change and change of cerebrospinal fluid, not only in the cranium or in the spine, but in the areas in between. This hydrostatic pressure change changes the neurology of the spinal nerve roots and indeed the physiology in the brain itself. So what we're going to do today is to show you how to rectify the Category 1 situation, bearing in mind that if this situation is not corrected, we get more and more torque at the sacroiliac junction, we get more and more hypofixation on one side, and the interosseous ligament starts to stretch and separate it, taking us into a Category 2. So at the moment we have a bilateral sacroiliac fixation. What we're looking at in bilateral sacroiliac fixation is first of all to put a patient onto a plumb line, into a distortion analyzer, observe what movement we have. In the Category 1 we're going to be looking for an AP sway, because one innominate has gone anterior and the other has gone posterior. In this vein here, the motion will be in an anterior to posterior motion, purely and simply because there is no movement between the sacroiliac joints, both of which are fixed. So the normal rotational movement that one would find at the second sacral tubercle is denied in the Category 1 problem. I'd like to introduce my patient today. He's Dr. Chris